Hi, I'm Christine Stankus. In September last year, I was elected by my fellow governors to serve as Bridgwater's lead governor. I am extremely proud and privileged to do so. This is my 4th year as public governor, representing the Rest of England constituency, which covers all those parts of the North West region served by our specialist community dental services. The other areas represented by public governors are Halton and Warrington, where the vast majority of our services are provided within an array of community settings. We also have staff governors representing our nursing colleagues, allied health professionals and non-clinical support staff. Prior to becoming a governor, I worked for the NHS Mental Health Services, starting work as a domestic on the old Winnick Hospital site and moving on to become part of the estates and facilities team at the old Five Boroughs Partnership, now known as Hollins Park. Like many in this room, I have seen many changes, but the one thing that has remained consistent has been the care and compassion we show to our patients, their carers and their families every day. As governors, we observe the work of the committees that support the work of the organisation. I have observed the work of the Quality and Safety Committee for almost 2 years. In that time, I have been struck by the diligence of those who deliver care to some of the most vulnerable in our communities. I am fantastically supported by my colleagues who observe audit, finance and performance, and workforce. The time my colleagues dedicate to Bridgwater should not be underestimated. It is at this point that I would like to pause and reflect. Remember 2 of our colleagues who very sadly passed away this year. Diane McCormick served as a public governor in Alton for 10 years. In that time, she provided us with unique insight and knowledge of the community in which she and her family lived. Paul Mandike represented the borough of Warrington. Paul had served as a public governor for 7 years. His passion for engagement and involvement was quite overwhelming. They give so much of themselves to their work as public governors. They are both very greatly missed, and we remember them both with great respect and feel privileged to have worked alongside them. I would also like to place on record my thanks to our executive and non-executive director colleagues, to all my governor colleagues for the support you have given me during the past 12 months. The role of lead governor can be challenging. It has been a steep learning curve at times, but by working together and continuing to support each other, I do believe we can move on to deliver some great work in the future.